Greetings again from Dr. Bill Wyatt with the American Orthodontic Society. I wanted to go over some adult orthodontics and things that we can do for adults. And this was such an excellent case to do that. This lady, I think, was 60 or 61 when we started working on her. And it's not just expansion of the arch, but she had a class 2 problem. She had some rotated teeth, and we actually had a bridge in there, and she had had extractions, and in one area the teeth were tilted way over and closed the space where the tooth was removed, and so we had to straighten that up. And we actually moved a bridge by just tied arch wire to the center part of the bridge. Just build it up a little bit and move the bridge over and expand it with the bridge. So there's just all sorts of things you could do. And this old nonsense that when you get 20 or 25 or whatever, they say your bone doesn't move, that's ridiculous. So just kind of watch what happens here. And you can do this, and there are just oodles of adults out there that would like to have their teeth straightened, and nobody offers to do it for them. And I want people all over the world to learn that you can straighten your teeth up regardless of how old you are. If you've got good bone structure there and everything's around where you can do it with part of the teeth or with all of the teeth, and you can do bridges and all these different things. So just watch this, and I'll try to point out as we go along with this what we're doing. Here we have this lady. She's about 61, I think, when we started here. She's got a class 2 malocclusion. She has a bridge that doesn't fit properly over here, but we're not going to do anything to that bridge. I'm going to get my little finger going here so I can mark on here. But anyway, we leave the bridge in there. And on this side, we'll straighten up the tooth where the tooth leaned forward into the gap. You can see on the x-rays when we get through with it. And of course, it's got a chip on this front tooth. I didn't have anything to do with that, but it's not filled with something that looks too hot. So let's go on here with the case. Now this is her models, so you can see we have a cuspid that's in a pretty good position here, but we're going to have to move this cuspid back to here. This is class 2. It's sticking over out here. And this is the tooth that's missing in here. So we'll have to straighten it up and see if we can get these roots coming more like they should in the crown right in here. You can watch this as it goes, and we got a kind of a crossbite back here, so we expand the upper arch to get it over. So she probably had some mouth breathing and some other problems in there, but this is adult orthodontics with somebody with all their teeth, and I've shown you several cases where they have a lot of missing teeth and things, and we took one lady and just moved everything from the back to the front, and she came in to get a bunch of extractions and teeth to set up, not the extractions from me, but we got to use it, moving them, and we just closed all the spaces. It's an interesting video. It's just called Closing Space on Adults. And we've had several thousand people look at that video. Now we've got just as fine of things here. I'm sorry if we're out here at the ranch and the dog must have a cold. Out here he's barking up a storm. Okay, the upper centrals are tilted, and we've got crowding in the upper and lower arches also. And you've got an upper arch here that's just, we're going to have to bring this out quite a bit, bring it out more than that. And I'll show you that as soon as we get through. We'll put the starting model against the finish model and show you that the bottom is also expanded, and this is a bridge right here. This is a crown, and I didn't try to cut the bridge apart and straighten the tooth of this. I just left the bridge, so this tooth is kind of leaning in the bridge. But I'll tell you, don't put bridges or crowns on teeth that are tilted. You can just upright them so easy. I've never seen a tooth that we couldn't upright, and you can do the same thing. It doesn't. You don't need any other orthodontics in there. Just put a little tube on the tooth you want upright and build a little spring, and then bond a wire. Now this tooth right here is badly rotated, so we rotate that too. I don't think I'll show that very much in here. All right, now just looking in the mouth, you can see how the bridge is and the overlapping upper teeth, and it doesn't look like it's class 2, but it is. This tooth right here has got to go back in that section. We'll show that in just a minute. All right, the upper arch needs a lot of expansion, and we're going to open up for this bridge. And if you look in here how this is curved, well, not that bad, but something like that. And we'll try to get that straightened out a little bit as we go. Let me erase that, and we'll go on with a low arch. And that's the bridge. And we just bonded a whole bunch of material on here, and I hooked my arch wire right about in here, and we expanded that bridge by that. And we'll expand, these are crowded and everything on the bottom here. So let's go. Now here we are, this is 1992, I think it was 91 when we started. So this is January of 92. And we've got gone a good ways in here, and we bonded a lot of material onto that bridge and put the bracket into that. And so we'll use that and spread that out. You can come up with little things to deal with adults, and you have to innovative figuring out how to do it. Now she wanted to use these plastic brackets or porcelain or whatever you want to call them made out of, and so we did that. We didn't have to do a whole lot of work with them. I don't like them for torquing teeth. They just don't do a good job. Now on the bottom we use those little bitty brackets, and you can take them low on the bottom, and you don't even see them as an adult. You don't have to have your brackets a certain height. You can go down with them as long as you come back up where your band is on your molar teeth back here. Let's go on from that, and now this is a little bit better. This is well, it's still January 92, and the same thing over here. All right, you know, we've gone over using this Big Daddy arch. That is the most useful thing. If you learn how to use, you can expand anybody's arch. I have never seen anybody that we couldn't expand their arch out. Now you have to work and get into a rectangular arch so you can put a buccal root torque on the teeth, and you have to have your wire going through there instead of being square like this. You have it going down something like this, and you straighten it up and stick it into here, and this wire is trying to push the roots out, or it'll push the tooth in if you don't have some big strong wire up here. But you put this Big Daddy wire in there, and it'll take those out, and you can expand those roots just as nice as anything you want, and you can restore these mouth-breathing kids simply by bringing the root structure out on the molar the bicuspid teeth up here, it opens the airway up that closed because they breathe through their mouth. It never got any pressure on it to open it. Now this is an adult though. This is 1992, and we're in here and we're bringing the upper teeth out over there to make them fit better. And here this wire is. We have the other arch wire is underneath this wire. This wire is tied on top of the tooth, and we kind of tie it in there, and it doesn't do much out here expansion, but a lot of expansion. You can bring them out in this area and leave this by the curve in the wire end, you see, or you can expand all the way back. You can do anything, you can just pull that arch, and the bone structure is still good up above and down below if you're doing this on the bottom arch. And this was such a good case to show these things. And we hooked this, bonded some material onto the bridge, and we just put our bracket in it, you see. And we were just moving this bridge just like a table with the legs on both ends. We're just moving it out and expanding the bridge, but leaving the bridge in there. We didn't want to cause all that expense of redoing the bridge. So anyway, here's the upper arch. You remember how we had that tooth in there over there? So we'll bring this big daddy arch wire back into here, and it is expanding this section, and you can expand it here and leave this, or expand it all the way, or expand this and leave that. Just how you bend this wire and get it fitting in there like you want the arch, and now you constrict it and tie it to the other arch. You see the other arch is right underneath this, going around like that, and it's doing little things like tilting and everything on the teeth. We have this one tied on, you see, with you either use a wire or we can use elastics on it. I like to wire it in pretty good. See it tied on with a wire right here. It's tied on with a wire here to the other arch wire, see. And then the big daddy wire is in a tube back here. That's a 045 tube. It fits in there, and I haven't found a person in all the years that I've been using this thing that you couldn't expand the arch on them. If the teeth had any bones, of course, if they didn't have the good bone, you could expand it easy. But I think we have a guy here that ended up way up in his 80s that we expanded his arch. And you can look in there. And by the way, when you get out the bottom on the video, and they'll have a little blue deal down there, you click that, and it'll pull the videos that have something of that nature in them up over one side, and you can look at the videos that are about expanding arches and different things like that. So you don't have to go through all of them. I think we've got about 610 videos now in there, and some of them I'm redoing and stressing some points that I didn't make 6 years ago when we started this. Now there the bridge is. We just bonded some acrylic onto it, put a bracket in it, you see, and now this wire, we came out with it with a omega and come back in here, and we're expanding this whole thing by this wire pulling this, easing this teeth out. Now if I'd had a problem, I could have come back in here and bonded something and tied that big daddy onto this, and I could have taken that bridge and just moved it out anywhere you wanted, right there. All right, this is 93 of 92, and this is 3 of 92. We've got the front teeth lined up now. The midline's right on. That doesn't matter. It is the size of the teeth is off. You can't get your midline right. But let's show you. We've got the teeth at 1993, and then we're still not, this tooth has to go in here, you see. So we're going to have to, you bring your upper, your molar over the bottom is going to come in kind of like this. And so we've got to bring this forward some, and we'll have to tilt these teeth out or torque them out as this tooth, as we bring this out to this point right there, and that'll correct that class 2 problem. Now, this is in a person that is about 62, 63, somewhere around in there. And here the upper arch is expanded. Now you don't see much difference in the width of it, but now I'm going to go on and we're going to get this cuspid right down in there. And we have to bring these teeth out here and kind of torque them a little more so that that fit up underneath that. Now, we're getting close to class 1 relationship here. This is 1993. 93 again. That's tooth that's filled. You see, that needs to be redone right there. I think she did do that. Got the correct color and everything in it. And then the bridge fixed off part of the crown right here, but I think it got fixed up later, and we brought this tooth to come down into that spot. It was 92, 92 again, 93, and we're getting close in here, but we're going to have to expand this, see, to get this out where these teeth fit over this bridge. And it's 4 of 93, and there's 6 of 93. Okay, here is where we'll show you the model. The cuspid was occluding right here, and we're going to move that cuspid over and put it between this gap and this tooth right here. We'll bring it up where it'll fit right in this area, and then pull this back with a whole notch. And this is done now on a person who is 92 or 3. This is the date, I think, down on there, 96. I didn't think she got that old that quick. But the cuspid is right there, and that cuspid was hitting out here now. And it's back into the correct position when she bites the teeth together there. Now, when you look at this from the front, you can see it, how it is. And let's see where the, okay, here it is now. In 90, I've got 96, but I think we finished this case, and this is a few years after we finished it. It's still holding up, and the teeth are fitting together better than they were. This is, you see where the cuspid, we moved it, and there it is back in a better position. And this is out, we kind of torque that. Now this is part of the shell of this crown that's cracked off here. I don't know what she did with that, whether she had that filled, or surely she wouldn't take the whole bridge out, just to, you could take some composite and patch that up and make it look pretty good right there and protect that tooth. And this is the upper when we started, and this is the upper when we finished. And if people tell you that you cannot expand after a certain age, this lady is 63 or 4 or something wrong with here when we finished. And this is where it was. Take them and show them this. Now look at where it was. I know the picture is a little bigger, but that's the distance from here to here is certainly more than from here to there. not measured from the pictures. You can measure it from the teeth themselves, and that it's just amazing what you can do orthodontically, and that's why I wanted to suggest that we start teaching restorative dentists how to do certain orthodontic things so they don't have to crown something they can take. It is such a waste to put in a bridge back here and then pull a wisdom tooth behind it because they don't have room where you could take the wisdom tooth and move it up there and fill that gap. And the second and third molar, or the bicuspid is gone. You can slide these teeth all the way up in there and fix the upper where they'll touch part of it back in there. So you can close spaces in a restorative orthodontics. And nobody's even mentioned restorative orthodontics. I don't think they teach it at all. I don't know all the orthodontic schools all over the world. Surely somebody is doing that. But anyway, wherever you are, if you're on get online, you can pull these things up. And I am very grateful for YouTube to put this stuff out. And Facebook, we're sticking a lot of them on Facebook and putting it up where you can see it with that. But we have a slew of these videos that cover just almost any problem you would have in orthodontics. We started from before birth till after you're I don't have anybody that's dead with it, but you can straighten people's teeth as long as they're living. And I'll take anybody say doesn't think that's true. You can come over here to the little town of Glen Rose, and I've got a room downstairs here, and I have all these records, or most all of them, and you can pull those records up, and I'll have something to show them on the wall or whatever, the record and the models and everything on most of these cases. So if you're an orthodontist, or you're somebody who would like to check it out, or you're somebody that would like to try to learn how to do this type of orthodontics, then I'm not trying to insult anybody that's been to orthodontic school, but and I don't know what every orthodontic school does, but the one we have here in Dallas, my understanding is they don't even teach closing spaces like that and bringing the wisdom teeth and stuff forward. Now, I talked with the guy that started the one in San Antonio, and I don't know who's running it now, but I doubt if they're doing that. They don't want to get out of the groove, and they like to do kids from 10 or 12 and 14 to 15 and up about 18, 17, 18. They say that, well, the teeth bone's hard and it doesn't move. It's such a mistake in there that they're being taught like that. So anyway, I hope you get something from this. We bonded a little 3 to 3 down on the bottom. You see that rotated tooth? It's rotated correctly. And these teeth are lined up. So it's got a little chip in that deal. And now here it is. This was 91, and she's aged 61 and 1 month right there when we started this. And this, she lost this tooth when she was early, and it leaned over like this. And we're going to pull it around. I didn't get it totally over this way, and this tooth will be underneath here, and we'll move all these forward, you see, and have this corrected. Now here we left this. Now if you have a situation like this, straighten the blooming tooth up before you put the crown on You can do it so easy. You don't even have to have them in braces or anything. Just bond a little wire on some teeth, and you come in here and put a little tube on this too, and come in here with a circle like that. It'll be down here. You pull it up and hook it up to this wire, and it'll straighten that thing up. I've never found a tooth we couldn't straighten up. Now, if it's ankylosed, you break it loose and then straighten it up. You can't move it while it's ankylosed or grown to the bone. So, thank you for watching. Now, here's the Big Daddy arch wire. See, it's just tied on in 2 or 3 places, and it's back in the tubes, and we're expanding that. And we've got this over on this side part of the way up here. I never did get it actually get the roots as far forward as I'd like to, which we can do today. We could very easily. So there we are. This is 1993, and we're still going with the case. And here it is in, she's age 64, and this is, I can't read that, but this is with her 3-to-3 retainer in the bottom, and you can see this tooth is pretty well up here. This one ought to be coming out there a little better than that. And here is the lady. And you remember what she looked like before. And we didn't make her protrusive. We straightened all that out and got her sitting right. And you look at her straight on, the vertical height of here and here and here, it's almost perfect. And now, this is her smile. Used to, you had dark mess, back in here. You don't see any of that anymore. And the teeth are lined up. Look at the midline right dead center, right there. And thing is, I don't know who I'm talking to and where you are. We get letters from people, or they write back things here from Vietnam, and got people in Iran and India and different countries anywhere in the world. And we'll try to answer your questions, and I'll tell you the truth that I know about them. And if I'm wrong on any of this stuff, let me know, and I'll check it out. And if I'm still wrong, we'll change what we're saying to people. But I tell you, adults can have their teeth straightened as long as they live, and I'll debate that with anybody that wants to argue about it. And we can expand cuspids on anybody, and there you go. You just move them back, but you got to move the roots back with them. And they thought for a long time you couldn't expand lower cuspids. You can do that. You can move a tooth into a knife edge ridge of bone, or cortical bone, but it takes a good long while to do that. If you're closing space on somebody, if you have them all ready when you go to extract their 6-year molars or something, have your brackets and everything on there, then take the tooth out, put a pad, you do it or send it, whoever wrote to do it, and it's the very same day, start moving the tooth in there. If you let the cortical bone close up in there, you'll just kind of close like that, you'll have a knife edge of hard cortical bone. And I'm showing you on that skull, there's a tremendous difference in cancellous and cortical bone. And you get this as hard bone, but you can move it, the body will pick it up, and with a little osteoblast, osteoclast, they don't care whether it's cortical or not, but it takes them a while to move it, but you can do it. So thanks for watching, and I'm going to close out, and hope you'll subscribe to our channel. We've got I don't know, it's over 5,000 people are in the that are subscribed to it, and we have over I've got 610, I think, the last count of videos here, and we were trying to put under every video a thing you can push, and it'll pull other videos that are related to that subject up. Then you can look at those videos and don't have to go through the whole thing hunting for them. Thanks for watching, and I'm going to say good night, and it's getting pretty late here, and I'll hope that you'll visit us again later on. So I'm going to sign off here.